are here in Indonesia and again with Dr. Adnan, and we would love to discuss breast augmentation today.
Okay, so breast augmentation means enlargement of the breast. The most common way of doing that is by using breast implants. Occasionally we also augment the breast using fat transfer. So which are the ideal candidates for breast augmentation? I think it's one of the most commonest procedures done worldwide. Millions of women have this procedure in the world, so it's very common and very popular. It's actually one of the most popular procedures in plastic surgery. So who are the ideal candidates? I think the best candidates for breast augmentation are women who either have small breasts, whether they're born with small breasts and breasts never grew in size, or with breast asymmetry, where one breast may be smaller than the other. Occasionally, massive weight loss can also cause a situation where some women may want a breast implant to project the breast again to what it used to be. Of course, pregnancy and weight changes associated with that can also have a huge impact. After pregnancy and so on, that's another indication of perhaps augmenting the breast. And let's not forget, breast cancer surgery. So women who've had mastectomy from breast cancer or wide local excision may end up with some degree of asymmetry in the breast, and they're also good candidates for this.
Okay. How do you choose the best implants? So I can see on your table different types of them.
So wide range of implants. I think the implants have been around for 60 years now or so they've changed over time as well, both in the material that's used to produce them. Most commonly used implants are made of silicone. So they have an outer shell made of silicone and an inner gel nowadays that it's not liquid silicone, it's more of a gel form that we use. How do we choose an implant? Well, I think it's more like what the patient demonstrates in terms of tissue characteristics that help me choose the right implant for them. So there's no one size fits all situation. Everybody is unique and every woman is different, and their measurements are very different in terms of the chest wall parameters, and they help as a useful guide as to what may look natural on them. And I use various adjuncts to help them or patients decide what implant may be the best for them. For example, I use Chrysalix, which is a 3D virtual kind of software, which is more than 90% accurate, and that gives patients an idea as to what they may look like after surgery. And I think that's really useful. I also use sizes before surgery at the time of consultation, just to give patients an idea again of what to expect. And then another very common question that I get asked is, doctor, can you place the implant above the muscle or behind the muscle? And my answer to that is, look, again, it's based on your shape, size and volume in your existing breast. And I think that helps me determine where to place the implant. Sometimes I place it behind the muscle in people who have practically no volume in the chest. But mostly, if patients have some volume, then it's preferable, in my experience, to place the implant above the muscle. Well, that's where the natural breast is normally. But I do, in selected patients, also place the implant behind the muscle or partially behind the muscle.
So, and how long ladies can enjoy those implants, and what are the precautions, and can they feed, can they go for pregnancy after the implant?
Good question. So normally, I say breast implants are not for life, although they haven't got a fixed expiry date on them. I give them a rough ballpark figure of 10 years, and they may need replacement after that. And that's not because the implants changed. However, the body does age, and nobody can stop aging, right? So because of the aging, the inherent breast tissue may change around the implant. For example, the breast may drop, even though the implant may keep its shape and position. And as a result, the overall shape may change, and they may need a bigger implant in the future or a breast lift. So those factors are always discussed at the time of consultation, and I go through with my patients in detail. I give them written information about what to expect afterwards. In terms of the other point you raised about pregnancy, well, there's nothing stopping women getting pregnant after a breast augmentation procedure. And in terms of breastfeeding, there is a possibility that women may not be able to breastfeed after a breast implant. So I'd say it's about a 50-50 situation. There may or may not. But again, it's important to inform the patients about all of these things. Another important thing people ask me is, do implants cause breast cancer? Well, I can categorically say breast implants do not cause breast cancer. However, in the recent years, there's a particular type of implant which is now not being used, which would cause a localized kind of a cancer, and it's very rare. I think the incidence of that is about 1 in 15,000. Considering 1 in 8 women would have breast cancer in their lifetime, the risk is extremely low. And that's called a breast implant associated anaplastic large cell lymphoma, long name, right? But it's extremely rare, and certainly I don't use those type of implants that have been known to cause that. Even if that happens, once you remove the implant, it cures the situation. So it's extremely important that after breast augmentation surgery, if things change in 5 years or 10 years, to seek medical help, seek the advice of a plastic surgeon in those situations.
So Dr. Adnan, how long recovery will take after breast augmentation surgery?
So I perform breast augmentation under general anesthetic. This is done in a hospital setting as a day case procedure. What does that mean? So they come in the morning, I would see them before surgery, I would do my necessary markings and drawings. They're also seen by an anesthetist, after which they have the procedure. In my hands it takes about an hour and a half to do one. And then they wake up, I don't use any drains, they wake up with minimal dressings and a bra, which I use for support, and they go home after a few hours. I advise my patients not to go to work for at least 7 to 10 days after this surgery, and to avoid heavy exercise for a period of 6 weeks. The scar I place in most of my patients in the inframammary fold, and it's a small scar, about 3 to 4 centimeters, which fades away with time to a point that it's hardly noticeable. However, in terms of post-operative care, I also advise my patients not to wear bras with wires for a period of 6 weeks, and to avoid contact sports and underwater diving, etc. But unfortunately, patients do what they like in this situation. But I do give them my best advice.
Thank you so much, Dr.
Pleasure.
Adnan.